We discuss topics that are new, wonderful, exciting, and important in the world of infertility. We are coming to you on TikTok, on YouTube, on Facebook, Instagram, and Twitter. So hopefully you can join us on one of those platforms. I am your host, Dr. Rahi Victory, and I am here with my trusty friend, Tarek Ibrahim from Ibrahim Strategies Group. And we're going to be answering questions tonight. I have been scouring the internet trying to find interesting papers to share with you guys, and there's actually virtually nothing new that's interesting. So I have yet to find anything really cool or great, but hopefully maybe next week we'll bring better studies out. So far it's kind of the garden variety stuff that's out there and nothing too interesting. A lot of really hardcore basic science stuff, which would undoubtedly bore you guys to tears. So we're going to take your questions tonight, and we are open to hearing your comments. If you have any feedback, we are more than happy to hear about what you guys have to say. I am a board certified reproductive endocrinology and infertility specialist. I'm trained in Canada and the US and licensed in both countries. And we have loads of patients coming to us from the US because we are far less expensive and generally have much more patient-centered care. So just fire ahead if you have questions tonight. We are happy to go over them, and we'll do our best to help you guys out. Do you have questions already?
Yep.
Already, eh? That's wild, man. Yeah, it's crazy.
It's a very unique question.
Okay.
Good evening.
That's a good start.
Yeah, I thought you'd like that one. Is Zika still prevalent and something we should worry about?
Yeah.
What is your opinion on alcohol while TTC? Thanks.
Oh, yeah, that's a great question. So we're working on a video for alcohol while TTC. So we will have an answer for you on that. I'll give you the brief synopsis here. But Zika is still prevalent in some places. So you do have to be careful. If you check the Centers for Disease Control or the World Health Organization websites, they actually have really nice maps that show you where the hot spots are. If you are pregnant or trying to get pregnant and you've had a recent Zika infection, it can be an unholy disaster for the baby. So you do have to be very, very careful. So if you go to a tropical place and you get bitten by a mosquito and you have any kind of symptoms that are flu-like, you definitely need to be evaluated and in some cases get a Zika test. If you're male, they're recommending 2 to 3 months of waiting, and female 6. So it can put quite a kink in the works when you're trying to conceive. With regards to alcohol, so we can talk about it briefly because I, as many of you know, never touch alcohol. I never have, I never will. So alcohol is definitely not good when you're trying to conceive. So for the men, it's an 83% increase in abnormal sperm morphology, a wild increase in the number or percentage of sperm DNA fragmentation, significant decreases in multiple aspects of sperm performance. Even testosterone is reduced by up to 10%. So overall for guys is very, very damaging, and it's a class 1 carcinogen. So that means it is known to cause at least 7 types of cancer for sure, and possibly 4 more. With regards to patients that are doing IVF or any kind of fertility treatment and they're female and they're consuming alcohol, there are very, very negative impacts on egg quality. There are impacts on your hormone processing and development, and so it does definitely have a very negative impact on your chances of success. More importantly, if you do happen to get pregnant and you're still drinking, the problem is nobody actually knows how much or at what point in the pregnancy it is most risky to be exposed to alcohol to cause fetal alcohol syndrome, which is why universally no alcohol is acceptable while you are pregnant. So we tell all of our patients to stop drinking or at least minimize it as much as humanly possible. For a cancer risk sort of profile, for women, more than 2 to 3 drinks per week is considered an increased risk of cancer. For guys, more than 3 to 4. So if you are someone that drinks, you definitely need to minimize the amount of alcohol.
Didn't Health Canada come out with something recently on alcohol? Did you see that?
No.
There's some new guidelines on alcohol.
Really?
Yeah.
I'll have to check that out.
Severe, they said.
Okay.
Like it's
like it's bad.
Yeah, well,
Well, finally they're figuring it out, yeah. Except Health Canada owns all those LCBO stores, right? So, yeah.
classic government.
Yeah. Hello to everyone on TikTok who's saying hello. Hi back.
There
Yep.
you go. Testosterone priming for more mature women with DOR. How long for the protocol?
Yeah, so they've looked at various protocols for this. I've reviewed several of the studies. They go anywhere from 6 weeks before your stim to the lowest I've seen was like just with your stim. So we do 2 weeks before. That seemed to make the most sense to me. And so we just start 2 weeks before. You are giving women a pretty potent androgen when you're giving them testosterone. So to give it for a long time, you really are risking them getting side effects like hair growth, acne, weight gain, things like that. So we don't give it to them for very long, but a reasonable period of time, 2 weeks before and through your stim is a very reasonable choice. And for us, it seems to be working really well.
Spotting for 4-ish days every month before period, normal or symptom of something else?
Not really normal, although it could be. So I'd get an evaluation for things like polyp, fibroid, get your thyroid and your prolactin levels checked, have all your hormones evaluated, look for adenomyosis. And then, of course, if you're at risk for any kind of problem, such as endometrial hyperplasia, so women that are obese, diabetic, hypertensive, irregular periods, PCOS, you need to be evaluated to make sure there's no abnormality in the lining, because those women are at risk for the lining getting thicker than it normally is. And when it gets thicker than it normally is, you're now at risk for having endometrial hyperplasia, and that is a significant risk factor.
Where estrogen priming suppresses your ovaries, would it help to take estrogen for a shorter period of time to maybe reduce the suppressive impact? This is for estrogen priming.
It's a great question. I can't answer that because I don't use estrogen priming. What I can tell you is that the one randomized controlled trial on estrogen priming showed a decrease in live birth rates. And we reviewed that on the show about 2 months ago. So I would be very cautious about doing estrogen priming. I'm not a believer. And if you use it for too short a period of time, it defeats the purpose of using it, which is to line up the eggs so they all grow together. So I don't believe in it. I think you get much better results from doing something like duostim than you do from trying estrogen priming.
Yay.
That's a good start.
I get to watch live for a change. Hello to the awesome Dr. V and T, the superhuman from Oz.
Oh, wow. Cool.
Thanks, Dr. V, for your great support answering my many questions. You deserve some Tim Hortons to be delivered to you.
Maybe that was that thump we heard outside.
You never know. Got the door.
Yeah.
Hi, does LH higher than FSH in early follicular phase always mean PCOS? LH 7.5, FSH 5.5, CD4.
Not always, but it's one of the signs that we used to look for. So I think it's reasonable to explore that. It's certainly possible that if you have an elevated LH to FSH ratio, usually more than 2 to 1, that there are signs and symptoms of PCOS that go along with that. But I never say one thing fits everybody. So no, it's not going to be universal.
What are your thoughts on using Conceive Plus?
No idea what that is. Never heard of Conceive Plus. I'd have to look it up. What happens if, we can't because we're screen sharing, right? I can use this.
There you go. Yeah, use that.
Let's see if it's charged. I charged it last week. Oh yeah, we're good.
You
Yeah.
want to pull up another question in the meantime?
Sure, yeah.
Okay. Any benefits to taking magnesium while trying to conceive and during IVF?
Yeah, I looked that up. There are some studies that show that it might be beneficial, but nothing that's really like concrete. So it's kind of hard to tell you for sure, but there are some studies that show that there is a benefit. Yeah. Conceive Plus?
Yeah.
Conceive.
And then you got
Plus.
a question on TikTok. I want to get tested for PCOS.
Sure. You can get tested for PCOS. So we do a bunch of different tests. So first of all, it's your history. Do you have signs of hyperandrogenism, which is too much male hormone? So those are things like high levels of hair growth, like on your face, chest, thighs, abdomen, hair loss from your scalp, acne, weight gain, central obesity. So we look for those sorts of things. And then irregular periods. You can see some signs on ultrasound, although there's a lot of variability in whether people accept those definitions or accept that criteria as part of the definition. And then we look at your hormone profile. So do you have high levels of testosterone or DHEA, or do you have a very high AMH? Do you have that reversed LH-FSH ratio? Conceive Plus appears to be a lubricant. Or is that a vitamin? Oh, it's a vitamin. 60 men's caps and women's caps, Conceive Plus. You know what? I'm not aware of any scientific evidence for that vitamin specifically, but as a general rule, vitamins are kind of healthy for you and necessary when you're trying to conceive. So prenatal vitamin with folic acid, vitamin D, your fish oils, coenzyme Q10, melatonin. For pretty much everybody, those are all going to be beneficial.
Hi, Dr. V. Do you have someone named Ashley T from your office? I just want to make sure it was someone who is actually reaching out to set up a consultation. I'm in the US.
Yes. Yeah. Ash is the front desk. So she sets up all the consults. I love Ash. Hi, Ash. If you're watching, I love you. Yeah, Ashley's awesome. So she is definitely the one that's helping you.
Hi, Dr. V and T. Well, finally.
No, the last one said T.
Well, I'm used to a little bit more. I'm used to a little bit more. They're warming up.
They're warming up, yeah.
My clinic is recommending
Glutathione?
Yeah, glutathione infusions as I prepare for IVF. Any research that shows this is beneficial?
Yeah, so I was just talking to someone else the other day who's a huge believer in doing glutathione infusions. I'm not aware of any direct evidence about that. I got to look it up. But again, any kind of vitamin antioxidant agent that is used can be beneficial. I haven't looked at the research on glutathione, but we were asked to get involved in a study on it. So I might jump into that study to see if it is beneficial. And they are giving it as an IV infusion. We'd have to look it up to see if it works. Maybe that would be a good topic for next week, glutathione. Yeah, but we can try that.
What is a realistic percentage of success for someone doing letrozole, Ovidrol, and IUI? I'm 34 with PCOS.
Letrozole, Ovidrol, and IUI?
And they got PCOS.
10 to 15% per try. Yeah, so that's a realistic expectation from your IUI, assuming your partner's sperm is good and your PCOS is involving you at a reasonable weight. If your BMI is higher, the chances actually go down quite a bit, so that can have a negative impact.
Hi, Dr. V&T. Any tips or tricks for the recovery process after laparoscopic surgery? What can one expect?
I'm typing in glutathione and IVF into PubMed. Yeah, tricks and tips. Don't overdo it. So make sure you have everything planned in advance so that people are there to help you afterwards. Definitely don't overdo, your activities. So you don't want to, decide the next day, I'm going to go back to working out and I'm going to jump around, I'm going to clean and cook and all that stuff. Just give your body a chance to recover. It's minor surgery, but it can be major surgery. I mean, I do my hysterectomies laparoscopically. Yes, it's done in a minor way, but it's still a major procedure. So give your body a chance to heal. It's still going through something traumatic that is not used to, even if you feel ready to go. So give yourself a chance to recover. Give yourself some time to feel good and to feel better. Get some rest and then avoid doing something that's going to interfere with your wounds. So you don't want to get them too wet. You don't want to submerge in a bathtub, at least for a couple of days. Make sure the wounds are well healed. Don't strain. No heavy lifting, that kind of thing.
I just had a failed medicated cycle, and now my next transfer protocol is a modified natural cycle with letrozole, progesterone supplementation, PIO, and suppository, HCG trigger shot, Neupogen, and that's all it says. It says and dot dot dot. Oh, and a couple comments. There's so many comments in between her initial submission
Got
and
it,
second
yeah.
submission. And in an immune protocol, interlipid infusions, hydroxychloroquine, Claritin, Peptic AC, dexamethasone,
Wow.
Lovenox, Prograf AF, naltrexone, and prednisone. Anything should I change or add? This is our
jeez.
Hail Mary.
I mean, that sounds like everything. The only thing I didn't hear in there was PRP. So I would do PRP if you have an unexplained failure, PRP into the uterus. It's about a 50% increase according to the studies. So that's something you should consider doing, but you pretty much nailed everything else we would do. I don't do that stuff though unless I know what I'm dealing with. So we do testing so that we can actually direct what, what is going on. Poor Dr. Victory, you look like your bed is calling you. Do I look tired?
No,
Yeah.
I don't see it.
No?
But you're normal.
I'm okay. I'm not that tired tonight, actually. I slept okay, but thank you for the comment.
There you go. They're watching for you. They care. Everyone cares.
I hope so.
Yeah, I care as well.
You care. I know you care, yeah. Yeah.
Yeah, so I had my son at 29 weeks 5 years ago.
Okay.
After 3 years of TTC, had a miscarriage at 9 weeks exactly 1 year ago. I've tried Clomid and Letrozole and 2 times HSG, no luck.
You need an evaluation. I need to know what's wrong. So it would be important for us to figure out if it's a problem with your, yourself or your partner, and then where the issue is. Is it sperm motility, sperm number, DNA fragmentation? Is it your tubes? Is it your eggs? Is it the microbiome? What's your egg quality like? Do you guys have bad habits? Is weight an issue? I mean, you would need a full consult. So those are the kinds of things we have to go through in a detailed history where we're finding out everything about you.
Does 5 milligrams of prednisone equal 5 milligrams of Medrol? What's the ratio?
No, they are not the same. I don't remember the ratio off the top of my head, but we use 12 milligrams of Medrol per day, and you're usually using 25 of prednisone, and it's not a 2-to-1 direct ratio, so I'd have to find out the ratio for you, but they're not the same.
What could spotting in follicular phase be? Period lasts 8 days and then spotting for a couple of days.
Polyp, fibroid, endometrial abnormality like hyperplasia, or God forbid, cancer. Abnormal uterine shape like a big septum that can sometimes cause some spotting. Abnormal hormones, prolactin's elevated, thyroid is off, FSH, LH are off.
How long is the wait for endosurgery? Is there a way to pay for it and have the surgery soon?
The only way you can pay to get your surgery done sooner is if you have to have it done for IVF. And it's kind of hard to justify that. So otherwise, no. You can't kind of skip the line to do surgery in Canada. That's just federal law, so we can't avoid that. If it's being done for IVF, like you've got a fibroid in your uterus and it has to be removed in order to do an embryo transfer, that's different. Endo's a little bit harder. Our wait actually has gone down quite a bit because we bought equipment to start doing some surgeries in the office. So I think our wait list just got a lot shorter. So you'd have to ask Mara, but I think we're looking at just a couple of months now where it used to be like almost a year.
What would be a normal FSH to LH ratio?
On day 3 of your cycle, your FSH should be whatever it is, your LH should be roughly half. Roughly. It doesn't have to be exactly half, but it should definitely be lower. So if the higher your LH is, then the more kind of abnormal that becomes. So if your LH is higher than your FSH on day 3, that's not what it's supposed to be.
Hello, IV effing coolest duo ever. That should be a shirt.
That would be kind of cool.
That should be a shirt.
I like that. That's a good one. Very good. Whoever said that, That deserves some likes. Thumbs up from me. Lots of hearts going up wherever they are. Yeah.
Yeah, lots of hearts.
Yeah.
Some likes.
Yeah.
Hello, IVF and coolest duo ever. One more time.
Okay. Yeah.
Yeah. Firstly, thank you for all the knowledge you share.
Oh, our pleasure.
Can you answer some questions about the IVF FET protocol?
Yeah. I can.
Number one.
Number one.
Oh,
There's a whole bunch.
I don't know, but there's a couple spaces like that. She got the intro in, and then.
All right.
So the first one that we'll go for is number one. Since ovulation is prevented by starting the progesterone before the LH surge, what happens to the dominant follicle that results from the letrozole stimulation if it is not rupturing to release in egg?
Nothing. It'll just dissolve.
Okay. Does it undergo atresia, or does it become a cyst or something else?
It usually won't become a cyst. It'll probably just become atretic and disappear. So usually it's not a problem. It may release, although the progesterone can prevent the release. So usually they just become atretic and they disappear.
Hi, Dr. VNT. My progesterone level the day of transfer was 31 nanograms per mil.
30 what?
31 nanograms
Okay.
per mil.
Yeah.
Is that high?
It's right on the border of high. Yeah.
That's the question.
We got one here on TikTok. So are there any supplements I recommend for endometriosis? There are. So the ones that we recommend are NAC, which is N-acetylcysteine. There is coenzyme Q10, curcumin, which is turmeric in powder form or pill form, and resveratrol. They have all been shown to have some beneficial effects on endometriotic patients. None showing live birth or anything like that, so make sure you take it all with a grain of salt. But there are some things that are beneficial about it. Hi, Carly. Carly just joined us too. Hi, Dr. V. Last transfer cycle. Would you suggest intralipids and PRP 7 and 5 days before and Neupogen? I need to know your full history, Amanda, but yes, in many cases I would, especially if it's your last transfer cycle. So that's not unreasonable. Yep.
Did I read the Howdy one?
No, we didn't get Howdy. From Texas?
I'm hoping, yeah. Howdy, Dr. VNT.
Howdy.
Should sperm DNA fragmentation be checked in RPL patients? If
Oh,
abnormal, how would you treat it?
Yeah, absolutely you should. So one of the things we know and we reviewed years ago, like when we first started the show, it's probably 3 years ago, I should probably do another review, is sperm DNA fragmentation and its risk of miscarriage. So it's 1,183% higher if you have high sperm DNA fragmentation. So you absolutely should have your sperm DNA fragmentation checked if unfortunately you're suffering from recurrent losses or miscarriages. How do you fix it? No smoking, no drinking, no drugs. That's number one. If he's obese, reduce his weight, get him on a clean diet, get him exercising. Keep the testicles cold. Take good fertility vitamins like we use ProFertile or Fertile Pro, but it doesn't matter which ones you want to use as long as it's a targeted male supplement. And make sure he's ejaculating every day or every 2 days, nonstop the whole month through, not just around ovulation. On the day of actually giving your sample, if you give a second sample 3 hours after the first, you reduce the DNA fragmentation by 80%. So that's a really easy trick to use that costs you nothing.
Modified natural FET,
Yeah.
letrozole,
Yeah.
CD 3 to 7, Menopur 150 milligrams, CD9,
Yep.
overdose trigger and PIO 0.5 milligrams, 36 hours after for 6 days. Should I do more Menopur? Should I ask for progesterone suppositories? Any concerns?
I have no idea why you're using Menopur, and that doesn't make any sense. So we try and avoid that unless you have a thin lining. You don't need to trigger, but there's nothing wrong with doing it. If you're using the PIO, you should always use it with the vaginal suppositories. It's much better together than alone. Can you still get pregnant with a PCOS? Do you want to answer that one, or should I?
Go for it. By all means, Dr.
Yeah, of course you can get pregnant with PCOS. So that's probably the largest population of patients we deal with is PCOS patients. So there's all sorts of ways to help you. Supplements, natural things, weight loss, diet, exercise, metformin, letrozole, Clomid, ovarian drilling, injectables, IVF. I mean, there are loads of ways to help patients with PCOS. I was just diagnosed with PCOS. Can I still get pregnant, and can I have high prolactin and testosterone? No, you need to bring your prolactin down, and it'll be much more difficult to get you pregnant if your testosterone is high. So we do use things that will control that. So talk to your RE and they can help you to control all of that stuff to improve your chances for sure. Hello, there's one more, should I ask?
Go for it.
Hello, Dr. V and T. Can you give your opinion on taking omegas prior to IVF, or can thin blood? No, omegas don't thin your blood enough to be detrimental, so we strongly support doing omegas for your IVF. Go for it. It's very good for your egg quality. Yeah.
Okay. Okay. My FET is coming up in 10 days.
Okay.
My GP just called to let me know I'm anemic. Is it safe to start iron pills 650 milligrams now? I'm vegetarian. Will it affect my FET negatively at all?
There are studies that have shown that women with low iron actually have a lower chance of success. So I'd correct your iron deficiency before I did your FET. Yeah, I would hold on your FET. Sorry. I got, how long before IVF should you start the omegas? A month. Do everything a month in advance.
When do you up the dose of PIO for women with endometriosis during pregnancy?
I don't up the dose during pregnancy. We up the dose when we're doing their embryo transfer. So we don't use PIO past 12 weeks. So you're going to do it in order to make the embryo transfer successful. That's what the study we reviewed showed, that if you had a higher progesterone level and you had endometriosis, you did better. So you want it right at the beginning when you're putting in the embryo, and then sustain it until the patient is making enough progesterone on their own from the placenta.
So tagging on to the glutathione conversation.
Okay.
Can you compare topical versus supplement versus IV?
No, there's no data on stuff like that, guys. Zero. There's no comparative data on glutathione IV versus glutathione oral versus glutathione IV.
But IV is always better. Right?
Well, I mean, delivery of the molecule directly to the bloodstream will probably give you better delivery because it's missing what's called the first pass effect, which you get when it goes through your stomach. You don't get the first pass effect when you do transdermal. So that can be beneficial, or you don't always get the first pass effect when you go transdermal. So that could also be beneficial, but I have no knowledge of glutathione, transdermal absorption. Yeah, not a clue.
Can Menopur plus trigger be an effective fertility treatment for hypothalamic amenorrhea?
Yeah, absolutely. That's a totally reasonable choice. Menopur and a trigger will help you tremendously. There's no reason not to do that.
Or is IVF better? Put on 12 to 15 pounds, but still no period after going off the pill. No more period when started the pill. That's the full question.
Say that again?
So the Menopur question,
right?
right?
Yeah.
So she's asking, is that hypothalamic amenorrhea, or is IVF better? She recently, I guess, put on 12 to 15 pounds, but still no period after going off the pill. Normal period when started pill.
Well, IVF is better in the sense of success, but if the only problem you're having is kind of PCO and you're not making and releasing an egg, you absolutely don't need to do it twice. Or do IVF. So I would just go for a very simple, straightforward attempt to do your treatment for PCO. So you basically want to just get on things like, if you're PCO, letrozole or Clomid, metformin, the supplements like NAC and inositol, coenzyme Q10, resveratrol, lose the weight, exercise. All of those things can make you regular, and then if there's nothing else wrong, you don't need any help. If you needed help because of some other factor, then yes, IVF is more successful, so it's better in the sense of giving you a higher success rate, but it's not necessarily mandatory. I got a question on the Today Show. The Today Show is asking us a question.
Sure, let's see.
I don't know if that's the Today Show.
I don't think it is.
I don't think it
But
is.
we'll take it.
But we'll take it. What does a duostim cycle look like? How many days between retrievals? Yeah, it's a great question. So the world expert on duostim, the guy that published the article on fertility and sterility, gave a talk at the conference I was at in Belfast. So just last week. So very interesting. They basically do your follicular stim like normal. You do your retrieval, and then 5 days later you come back, they start you on the meds again, and then they start monitoring you and you do your retrieval when you get more eggs. I put my hand up and said, what about doing what we call split duostim, where we actually put patients 1 month apart, because we find that we get a lot more eggs that way, and they had no knowledge of it because they hadn't tried it yet. So what we found very early on was there were a lot of patients that just didn't have that many eggs to grow in the second cycle. And sometimes it was taking forever to stim them, and they were just on meds like forever and ever and ever. So instead of doing that, we said, why don't we just let the patient naturally release their egg in the next cycle, and then wait a few days and then start their stim. Now you've got all the eggs that didn't grow in the first part, and you can stim them and grow them and get them then. And it's actually working out really well because we get a lot more eggs that way. So for us, the duostim is often a split duostim, and that works out really, really well. Happy Tuesday, T and V. Which, if any, anxiety medication off the top of your head are okay during IVF? All of them have risks of cardiac and respiratory lung defects. So none of them are quote unquote safe, but you do need to balance your mental health. So that's something to review with your RE or maternal fetal medicine specialist or family doc. None of them are safe, but I've also never seen a problem from anyone using them. And certainly these days there are a lot of people that need it. So we see that all the time.
Let's get some likes on TikTok and Instagram. Tell them to give us some likes.
Tell them to give us some,
Give us some likes. If you're having a good time watching the show,
only a
give us
social
some
media
likes.
guy would say, give us some
Give us some
likes.
likes. We got questions. We got a lot of questions.
Tarek would humbly request that you guys give us some
Give us
likes.
some likes. That's right.
In your office, what seems to be the most common reason to need IVF? Endo, PCOS, unexplained, or age?
Great question.
That's a great question. Yeah, I don't think we've been asked that before.
Oh, you got something.
I got a gift. Wow, I don't even know. I got a rose. That's very sweet. Thank you. So you know what? The most common cause is probably that people realize that their ovaries are not working as well as they would like to, and now they feel the crush or the pressure to hurry and do IVF. Second most common is probably male factor. So years ago, it was actually blocked tubes. But now it's more like the guys that are the problem, where they just don't have great quality sperm. And so a lot of women are willing to go through the process so that they can achieve their family. And God bless you all. We love and cherish and respect and honor you for that. So yeah, it's mostly age, and then it's going to be the patients that have male factor. You can definitely do better with endo doing IVF than almost anything else, although those of you that watch the show know that we kind of have, the protocol that we use, which includes surgery in it too. So it's not just IVF. For PCOS, you do not need to do IVF in most cases, as I mentioned just a moment ago. So I would definitely focus on doing everything possible to avoid IVF with PCO, and then do it only if you need it. PCOS, can it be fixed, in caps? Yes, it can be fixed. It can't be cured, but there's lots of ways to control it. Yeah. And thank you to Manda, who sent us the rose.
Rose is nice.
Number one. Just got the number one gifter badge. That's really nice. Thank you. Oh, that's very sweet.
Great.
That's
You
great.
gotta ask sometimes. It's okay.
Yeah.
They're asking questions. We're asking for likes.
That's not really my style, man.
No. I'll ask out loud.
You can ask. Yeah, I don't think you're off camera. No one's gonna get
can't
mad
be
at you. Yeah, I'll probably get flamed for telling people I wanted likes. All right.
Don't worry. Yeah. So, hi, Dr. V, and favorite tea. Aha. Nice one.
There you go. Yeah, you are the favorite. You're the
Are
fan favorite.
over-the-counter prenatal vitamins as good as prescription ones? Is folic acid a must, or general folate is okay too?
General folate. I think you might be asking, is methylfolinic acid as good as the other one? So folic acid or methylfolinic are both fine unless you have the MTHFR mutation, in which case then you need the methylfolinic acid. As far as the garden variety stuff, the vitamins are generally good. The prenatals that are prescribed have much higher doses of folic acid in them. Not everybody needs that, but there's no harm to it. So it's reasonable for most patients, but do I give prescription vitamins to everybody? No, but we do give it to a lot of our fertility patients. We use a lot of what's called Pregvite Folic 5. The patient that asked, can you fix PCOS, says it's for a 26-year-old daughter and is asking 500 times. Okay, so PCOS, number one, diet and exercise. Okay, so PCOS actually should have 3 separate approaches to it. So number one, medications. So you can treat PCOS by doing letrozole plus minus metformin if your weight is high or you have insulin resistance. Number two, there are natural approaches to it. So the natural approaches are to use supplements. Those supplements are NAC, which is N-acetylcysteine, coenzyme Q10, inositol, and resveratrol. All of those have been shown to be beneficial for sensitizing you to insulin, potentially helping you get a bit more regular. And then third part, and it's the most important part, you must eat 6 meals a day, breakfast, snack, lunch, snack, dinner, snack. Low calories. You got to get rid of as much carbs as possible. Eat a very clean, healthy diet, lots of protein, vegetables. Essentially, that's most of the diet that you need to have. And you must exercise to build muscle. So not exercise to go on a treadmill or go for a walk. Those are useless when you have PCO. You got to build muscle. The more muscle you build, the longer you're burning off more calories. And those calories are what you're fighting the whole time. So medication, natural, and lifestyle changes. That's how you treat PCOS. Sorry and thank you. Your caps are on, Sarah. Anyways, it caught my attention though.
Of course.
Yeah.
I was even watching the caps over here. It was like a cap show. Hey, Dream Team.
Oh, Dream Team. I like that. Yeah.
What are your thoughts on low-level laser therapy? Any recommended protocol? Is it safe to use after ovulation?
So I looked at this. I'm actually trying to buy the low-level laser light therapy machine for sperm. My lab director looked at it and she said she doesn't believe it enough to do it yet. So we're not going to do it yet. There is nothing showing that it's beneficial for women that I'm aware of. For men, it's helpful if you shine it on the sperm sample. And there are some studies that support that it's beneficial, but who knows? I mean, it could just be hokey pokey stuff, right? These are not great studies. So we were looking at doing it, and I think we will, but we haven't started it yet. We got bigger purchases than red light laser therapy to improve stuff. And let's be honest, if you're at the stage where you need red light laser therapy or red light therapy to improve sperm quality, you probably should be doing IVF, in which case the red light's not going to help anything at that point. So, yeah. Thank you, Sarah. She's saying nice stuff on TikTok.
So remember questions 1, 2, 3? Remember?
Yeah.
So number 2.
Number 2. Okay. Yeah.
If the dominant follicle
Yeah.
is not releasing an egg
Yeah.
and forming a corpus luteum,
Yeah.
then do you have to provide any estrogen support when you start the prog, since there is no corpus luteum producing E2?
The corpus luteum primarily produces progesterone. It's producing very little E2. And no, you don't need any estrogen support because you're going to have some estrogen support that's still sustained from peripheral production, so you don't need to make extra. Unless your lining is getting really thin. Then sometimes yes, but we rarely add in estrogen. Very, very rarely. Yeah.
I'll tell you that word corpus luteum, that sounds like a serious thing.
Can you purchase the stuff to do immune testing? Can I purchase the stuff to do immune testing? This is from SMBC Can. No, but can you purchase it? Yeah, through Fertility directly. You don't even need us. It's like a call them and order it kind of thing, or via electronics. So go to the Fertility website and just order their, they have an immune panel. They have their own. We have one that we made them create for us where they added some extra stuff because they made them give a better deal. So yeah, you can try that.
How much ubiquinol should you be taking for pre-IVF? IVF in 6 months.
How much ubiquinol? 600 milligrams a day. Hey, we got a cool message.
Huh.
Do you see that one?
I see some of it. The keyboard one makes it hard to read. For me.
RN4. I enjoyed working with you years ago. Super kind and an amazing doctor. I was unit aide, but now RN. Good for you. That's awesome. What a great transition to go from watching people running around doing stuff to jumping into the action, so to speak. So good for you. Congratulations to RN4. That's amazing. And thank you for the kind words.
And she found this.
And she found us. That's awesome. Yeah. Yeah.
Hi, Dr. V. If I had 2 failed FETs with lupron suppression,
Yeah.
do you still think I need to do I need it in my 3rd FET? Does LD give you a long-term side effect?
If you're doing it for too long without estrogen supplementation, yeah, it'll thin your bones. So there can be long-term side effects. So I would avoid that for sure. But as far as do you need a 3rd one? Probably not, to be honest with you. And again, it depends on how long you suppress for. If it was just monthly, that's not really suppressing you very much. But if you did a 3-month and then an FET and then did another 3-month and then FET, I wouldn't make you do it again for sure. Yeah.
What steroid do you typically recommend and why?
We use Medrol for all our FETs, but for the patients that have immune problems, we switch to prednisone. I don't really know that there's a substantial difference between any of them, so I think you're okay with any of those. They're going to give you good results either way.
Is it okay in a modified natural cycle to start letrozole on cycle day 4? This is when my doctor is having me start.
It's probably fine that everybody's normally starting on day 3, but I don't think missing by 1 day is going to, move or shake anything significantly. So you'd probably be fine. Yeah, physiologically, it wouldn't make a big difference. What should I ask naturopath doctor as far as fertility goes? Any suggestions on that? Well, you should call Jen Strong, our naturopath. So Dr. Strong is amazing. I would ask them what they're going to offer you to help you, what their knowledge and experience is specifically with fertility. There are naturopaths that specialize in infertility. So that's what you want to be dealing with, someone that really knows their fertility medicine from a naturopathic perspective. So ask what their experience and skill set is with that.
If they need clarifications, they can always come and check with me as well.
Come and check with Tarek. Yeah, for clarification, check with this guy. Yeah.
What are your thoughts on PRP?
Okay, so there's kind of 3 branches to PRP, right? So there's PRP for thin endometrium. It definitely has shown a lot of promise. Some people swear by it. We've seen some benefits. It doesn't work for everybody, but for most people, you see a 1 to 2 millimeter increase. So I think that that's a reasonable thing to consider. There's PRP for unexplained infertility, or for unexplained failed FETs. It is definitely good for that. So there are lots of studies, including randomized controlled trials, that have shown a significant benefit. So for that, it's a no-brainer. You should do it. PRP into the ovary, nobody knows yet. So we're not really sure, but we are going to start doing it. So for those of you that want it, we can do it and we will do it. So yeah, not a problem. JE Victory 0. Hi, baby. My baby's on.
Look at that.
Hi, honey. I love you.
That's nice.
She says, comments on Insta are worth tuning in alone to this.
Absolutely.
Hi, Hi, honey. I love you. My daughter's watching for those of you that are wondering what I'm talking about.
All right. Is occasional prolactin levels around 40 nanograms per liter normal for PCOS patients? Does that level need to be corrected for an FET?
You need a monomeric prolactin first. So prolactin's a funny molecule because when they test it, the way it's tested, it can be falsely elevated by something called macroprolactin. So you actually need to have a monomeric prolactin and a macroprolactin and find out what your monomeric prolactin is, because that's the actual active prolactin. If that's elevated, you need treatment. If it isn't, you don't.
So this may be annoying for our users, but for whatever reason, Chrome just refreshed on its own.
Kicked everybody else off.
So, no, everyone's watching.
Oh.
But all their questions
disappeared. Oh, no.
So if your question wasn't answered yet.
Yeah, ask your question again if you wasn't answered, because for some reason Chrome refreshed and we lost your questions, folks. Sorry about that. So if you have questions, fire away and ask. We'll be happy to answer your questions.
How common is an ectopic pregnancy after IVF transfer? It happened to me on my first transfer, and I'm nervous it could happen again with the upcoming FET.
If they're using ultrasound guided, it's usually very low. We've had, I think, one in the history of our program. So it's very, very rare to see that. But if they're not using ultrasound guided, it can happen because you can go up too far. So yeah, that could be a problem. SMBC can, yes, fire away, you have a question. And she says she has an older question. I don't know what that means, but go ahead with your older question. We're all ears.
Do you recommend PGTA?
Great question. There is so much controversy and confusion about PGTA. Nobody knows the right answer. What we do know is that there are studies that show that it can shorten the time to pregnancy, but that's about the only thing that it has been proven to do. Now, how valuable is that? Well, it probably means you're doing less cycles and you're probably getting less stressed and less annoyed and all of that stuff. But I think that it's a reasonable thing. If your age is over 38, for sure, we encourage it. 35 to 38, it's kind of a gray zone. No one's really sure. Less than 35, I just don't think the data is there to support it. It doesn't make a lot of sense to me. SMBC, talked with my doctor about my protocol for FET, going to do natural, no letrozole, as my body doesn't react well with it. But doctor said if my lining is thin, she will add in estrase. Okay, that's fine. Just tell them to put in like a minimal amount of estrase, like 0.5 milligram. That's all you need and it'll thicken. So you don't, people are getting like 12 milligrams of estrase per day. Those cycles are crazy. You're just being flooded with estrogen. It's not necessary. Don't do that.
Is it okay to sleep on your right side in the third trimester of pregnancy or only on the left?
Okay, so the reason you're not supposed to be flat is because your uterus will flop down on your inferior vena cava, which is a vein, and it has the ability to kind of compress the vein enough so that the blood flow from your legs, everything south of your uterus, is not easily coming back up to your heart. So it cuts off blood supply, and then your brain goes, oh my God, I don't have blood supply. I got to protect the heart and the brain, and it shuts off blood flow to the uterus, which is obviously bad if you have a baby in there. So the reality with this is that you can be on either side, because then the uterus rolls off of the inferior vena cava. So right side, left side doesn't matter. Just don't be flat on your back. You can even be tilted. Just don't be flat.
What do you think of IVF add-ons? Pixie, good media, calcium, etc.
Well, Pixie has been proven to be useless. We've reviewed that on the show, so I don't believe in it. Calcium, if you mean calcium ionophore, we do use it in cases where they failed before. The studies are reasonable for supporting that. They're, again, not amazing studies, but the majority of them show a benefit. I don't know what you mean by good media. I mean, obviously you need good media. The media for IVF does make a huge difference. So good media versus bad media, you'll definitely see a difference. There's some here. Do you want me to grab them? Because they kind of roll by quickly.
Got a couple of these. These people might be.
Have been waiting?
Yeah.
All right.
I think.
Okay.
How do you use letrozole with DOR protocols?
So the studies show that if you integrate letrozole into the stim, it increases the live birth rate. So we just integrate it into your stim. We use it for 5 days and we see how you do.
What are your thoughts on karyotype testing?
For recurrent pregnancy losses, we do it. You don't need it, generally speaking, otherwise, unless there are other criteria that are there, like if you're a woman and you're very petite, less than 5 feet, if you're going into premature ovarian failure, less than the age of 35, those sorts of things are indications for it, but otherwise, no.
Please repeat the natural supplements used for treating PCOS. You were speaking so fast and didn't note them down.
Oh.
Also, what's an alternative to metformin? I react to metformin so badly. Please spell.
Okay, so there is Glumetza instead of metformin. So that's GLUMETZ or ZA. And that's long-acting metformin, so it has 40% less side effects. So that's Glumetza. The supplements are NAC, N-A-C, which stands for N-acetylcysteine. So that's A-C-E-T-Y-L, and then a separate word, C-Y-S-T-E-I-N-E.
I feel like I'm watching a spelling bee. I'm kind of impressed.
Can you use it in a sentence? Then you're going to use inositol, so that's I-N-O-S-I-T-O-L. And then you're going to use coenzyme Q10, so that's just CQ10. And then you're going to use resveratrol, so that's R-E-S-V-E-R-A-T-R-O-L. Those are the 4 supplements you're going to use.
I think you deserve like a major round of applause or major likes for spelling each one of these.
That's it. Maybe I'll get another one of those awards.
One of those roses.
One of those roses, yeah.
Great.
Oh, we got a heart.
There you go. They need to be stomping those hearts through.
Stomping those hearts.
Absolutely.
Yep.
How do you use that one? Sorry. Do you do PIO for natural IVF since it's a fresh transfer?
Yes, and that's been shown to be better. So whether you're doing a natural IVF or not, PIO, progesterone support, even for a natural IVF cycle, has been proven to be better than just your natural progesterone on your own.
How many months after endoexcision surgery are you most likely to conceive naturally? Trying to figure out how long to wait before IVF. Sure get was in October 2022.
So your endo is likely to return within 6 months to a year. So if you're hitting the 6-month mark, you better start some kind of therapy.
Any tips for one round of OE IVF if diagnosed with POF? Very little notice and need to start this month.
OE?
Yeah.
I don't know.
OE-IVF.
Own egg, maybe? Yeah, own egg
egg.
IVF. Yeah, okay. I haven't heard
These
of
terms
it.
are...
I know. I even as a specialist, I'm losing control of this. Yeah. So, any suggestions? DHEA, testosterone priming, probably human growth hormone. Eat healthy. Lots of vitamins, melatonin, coenzyme Q10, the fish oils, the prenatals, vitamin D. Try and de-stress as much as possible. Eat super healthy, no smoking, no drinking, no drug use. We use a flare protocol, definitely use letrozole. Don't take super high doses of gonadotropins because the super high doses result in terrible egg quality. Those would be my suggestions. Can I answer this one real quick now?
For it.
What are my thoughts on going gluten and dairy free for an FET? So if you have a generally inflamed immune system, it actually probably might be helpful, but if you don't, it's probably of no value. So If you have autoimmune conditions, if you have a really strong immune response to things, yes, then I would do that. But otherwise, no. And SMBC is asking, does that sound right? Does prednisone affect baby negatively? High doses of prednisone have been associated with cleft lip and cleft palate. We've never seen it, and I've used a lot of prednisone in our patients. We're not using that high a dose.
I may have asked this question, I'm not certain.
Okay.
Is occasional prolactin levels around 40?
Yeah, you asked that.
Okay.
Yeah.
Is there any benefit to using Clomid for women over 40?
Well, it depends on the scenario, I guess. So is there a benefit to using Clomid to help you make more eggs? Yes, if your goal is just to make more eggs, because it will increase your chances of success. But it depends. If you're unexplained infertility, it's useless alone. You have to do it with insemination. If you're using it for IVF, it's kind of like using letrozole, so that's fine. You can use it in the protocol with the gonadotropin shots. That's probably what you need. The rose is your gift in return of the stims I'm currently on. Just kidding. Thanks to your team, you all rock. It's
Awesome.
cool. Thank you. Yeah.
Hi, Tuesday's terrific team.
Oh, that's a new
Can you
one.
explain the process for DE with your clinic? Do you have an egg bank or work closely with a DE bank? Thanks.
Yeah, we don't use frozen eggs. I mean, we can, so we can work closely with any of the donor egg banks, but we prefer fresh because the success rates are much higher. So we coordinate you with an agency that will find you an egg donor. Then you select the egg donor that you like. Then we screen them, which is like meticulous. I mean, I go through every detail of their personal history, their family history, smoking, drinking, drug use, education. I mean, their health history, everything, you name it. We go through all of that stuff with them, and then I test them. So hormones, vitamins, ultrasound, genetic testing, drug testing. We screen everything you can imagine. And then if they pass all of the testing, then we put them through your cycle. So we are very meticulous, and I do not let patients use donors that are not good. Like, I'm very, very restrictive about that. You're getting a bad donor, I won't let you do it, because we have almost 100% success with our donor egg program. I'm not messing that up for anything.
I had an ultrasound at 6 weeks, 4 days.
Okay,
And the baby's heartbeat was 124.
that's perfect.
I will be 9 weeks tomorrow and heading to my last clinic appointment.
Awesome.
What's the chances of a miscarriage at this stage?
Less than 2%. Once you've seen a heartbeat, it's less than 2%. So you should be very happy. You're probably fine.
My prolactin monomeric was 44.7 nanograms
Oh
per
yeah,
liter,
you need treatment.
and prolactin was 55 nanograms per liter.
Yeah,
Is that
you
right?
need you need treatment. Yeah.
How does breastfeeding affect fertility? Should I stop breastfeeding if I'm TTC?
Yes. So breastfeeding means your prolactin levels are high, which means your estrogen levels are low, which means your lining is thinner. You probably won't ovulate as regularly. It is definitely harder to conceive. It is not birth control, so keep that in mind. It is not birth control, but it is harder to conceive, for sure.
Can you talk about hydrosalpinx and how soon after surgery can you transfer?
I mean, in theory, you could probably transfer a month or two later, let the immune system settle back down to normal, and you're good to go. As far as anything else about it, I mean, it can be done laparoscopically. It's not very difficult. Make sure they're using something like the harmonic scalpel and not bipolar cautery, because the blood supply that's shared between the fallopian tube and the ovary is where they're going to be cauterizing, and the more of it you damage, the more you're compromising ovarian blood supply. So the harmonic scalpel has only 1 millimeter of lateral thermal spread, so it's a much more finesse instrument, but you got to have a good surgeon because it's not an instrument that just anybody can use. It's kind of delicate. So I train people on how to use it, but it is a finesse instrument. It's not for everyone.
Hi, Dr. Van T. Until what week do you recommend PIO? My clinic does 12 weeks for all. Thank you.
Yeah, we do 12 weeks too. I don't like changing anything till your placenta has comfortably taken over everything. Keep in mind, we are in the minority in that one. Most clinics stop after 6 weeks. Some stop after heartbeat, some stop after 10 weeks, but I don't like doing anything till 12. I have a consult with you next month. Yay!
If using letrozole in the past to grow eggs, but it caused cysts that wouldn't resolve for months and elevated FSH in the subsequent cycle,
Oh.
would you still recommend it for FET?
Wow, that's a good question. No, although I would be doubtful that the letrozole was the cause of the cyst, but if it genuinely was, no, I'd be careful. Yeah.
Can you talk about hydrosulfates and how soon after?
We did that. Yeah.
Dr. Vinci, hold on. Okay. Hi, Dr. Vinci. How can I come to you for an FET? I have 6 untested embryos at another clinic,
Yeah.
and I've already had 3 failed FETs and 1 early miscarriage. Can I transfer my embryos to you from Toronto?
Yeah, absolutely, you can. I mean, I would say first get a consult with us because often I can help you without you needing to switch clinics, especially if you have government funding, because I don't want you to lose your funding. So I can kind of give you the protocol and you can see if you can convince them to do it. As long as your embryo quality meets our metrics, then yeah, by all means, you're happy to, or welcome to ship your embryos to us, and we will happily take the embryos and use our protocol and transfer. So just start by getting a consult with us. So if you're obviously in Toronto, just have your family doc refer you to us. And that way it won't cost you anything. And then we'll go through the whole fertility thing. And then we'll figure out if doing the embryo transfer with us or doing something else or whatever the case is best for you. And then, yeah, we can go ahead from there. That way it doesn't cost you anything at least. 9 o'clock? Okay. All right. Should we call it quits or is there 10 million more questions?
There are 10 million questions.
But we need to call it quits.
Fine, I'm just letting you know the time as well.
Okay, so we're going to call it quits. It's 9:02. I actually have a meeting in 15 minutes anyways. So thank you all for joining on all the various platforms. We love you all. Please share. We love it when you guys share. So if you're joining us, share with your friends. Tell them, hey, you're watching Victory. Put up as many likes as you can so we keep Tarek happy. And thank you for watching on all our platforms, in particular YouTube, which is exponentially growing for us this month. So thank you so much. We really appreciate it from Tarek and I both. We love you all. And if we can help you, let us know. That's what we're here for. I hope you guys have a great week. I am off to a ski trip this weekend. So lots of love to you all. And if my baby is still watching, honey, I love you. Have a good night and get your homework done. Love you. Bye.